For clinicians listening, what are the top three take-home messages that you would say from your research that you would like to see them apply or keep in mind?
Although they say that we should only do foot exams at each visit for people who are high risk, I would beg to differ just because I've seen people who are not necessarily high risk who come in with wounds. I had a man who came to me from a nursing home and they were doing some sort of wound care for the past 3 weeks. And whatever it was, I could look at it and tell this is not healing well. Called my podiatry friend, said, can you get this guy in sooner than later? Sure enough, when she saw him 2 weeks later, she had to send him to the ER and he had to go to the OR to get a debridement because his wound had gotten worse. Whatever they were putting on him at the nursing home was not working. So check everyone's feet at every visit would be my first rule of thumb. My second is empower your patients to see podiatry, to make sure that they're getting their toenails cut, to make sure that they're getting diabetic shoes if they qualify, and also just to get a good proper shoe fitting because a lot of our patients are not wearing proper shoes. So it's a lot of good teaching that we can do. I typically do it while I'm examining their feet to show them things, and I will review this with them. And I even wear sneakers. I'm a model for them. So I'm flat-footed myself. I don't have diabetes, and I purposely will wear certain sneakers that are approved by the Podiatric Association, like Hoka, Asics. For my people who don't have big arches, I show them, you see the difference between my shoe and yours. So in real time, they can see. And I remember I have a nurse who's on 12-hour shifts in the ED. And just for her switching her sneakers out, she had leg and foot pain that was much better. For years, she walked around in pain because she was wearing the wrong shoes. Like me, she's flat-footed. And she switched out her shoes, and now her pain is so much better. So again, that education about footwear and how to look for bad things with their patient, so important. And then the third thing that I like to teach people that I actually learned from vascular surgeon is just because someone has a palpable pulse, it doesn't mean they don't have vascular disease. They could still have PAD. So in the ADA guidelines recently, they have suggested that people over 50, people with diabetes for 10 plus years are high risk people like end-stage renal. We should be doing a baseline screen. It's really important that if you're ordering the ABIs, which is our arterial brachial index, that you put in so that the tech knows to include the tibial pulses, because traditionally they don't include the tibial pulses. And that's where the disease can be for most people with diabetes. So I always make sure to write in when I send people for these vascular studies, please include the tibial pulses because people can have severe disease there. And God forbid they get an ulcer, that can actually be really a problem.
How can doctors advocate for better care and outcomes for patients with diabetic foot ulcers in their own practices? Is there anything, even I know sometimes there's like nonprofit funding for maybe things that aren't covered by insurance, but then there's also other things such as maybe communication across disciplines and things like that. What are some of the ways that you'd like to see doctors advocate more, be more proactive?
I think one of the best ways you can advocate for your patients is to speak. So like how I'm speaking here today, how I spoke at this conference, and I put myself in rooms where there are politicians and I speak to them about this to make them aware because a lot of them are not aware of this. Even a lot of physicians are not. So really going out and speaking about this, being passionate about this, bringing it to people's attention, because this is not just a Bronx problem. This is a nationwide and actually a worldwide problem. So just speaking is the first place to start. Second thing, you can always write letters and call your local Congress people, your assembly people, and make them aware of any possible bills. You can always go to congress.gov and look for bills that need to be passed or local bills, so, your city council, and bringing them awareness to, I'm Dr. So-and-so, and I'm writing this letter. One of the nice things is nowadays, a lot of our societies have a pre-written letter or template that you can use. So if you're not a great letter writer, which some people are not, you actually could just use a template for that. So I would say those are some easy things that we can do to advocate for our patients.
Perfect. Well, this has been an amazing conversation. Thank you so much, Dr. Myers, for joining us.
Thank you, Esther. I appreciate you.